Hi everyone, my name is Deepthi. Welcome to Learn English with Deepthi. Currently we're living in the middle of the coronavirus pandemic, so I thought that we should take a look at some common terms, medical terms, or the terms that we hear on the news all the time related to the Covid-19. So first let's take a look at the term asymptomatic. This term means a person who is infected with a disease but they are not exhibiting any symptoms of the disease. So to understand this, we need to know what the difference between disease and symptom is, right? A disease is the name of the illness. Like common cold is a disease. Chicken pox is a disease. The symptom is how our body responds when we are infected with a disease. So the common symptoms of coronavirus that we know about are shortness of breath, sore throat, fever. Some people lose their sense of smell. Some people lose their sense of taste. These are all common symptoms of coronavirus. The coronavirus is one of those diseases whose symptoms is very different from person to person. If you talk to two people who have COVID, they will have completely different symptoms. So asymptomatic people are people who have COVID but they have absolutely no symptoms. They think they are healthy, they look healthy, they don't feel any different, but they are infected and they are transmitting this disease to other people. This is one of the biggest problems because we don't know who is infected. If I don't feel unwell, I'm not going to go to the doctor, right? I'm not going to get treatment if I feel that I'm perfectly fine. But I may be ill and I'm spreading this disease to other people. So this is why asymptomatic people are very important in coronavirus. For coronavirus, we cannot treat the disease because they haven't found a treatment for the disease yet. We can only treat the symptoms. Like if you have fever, they'll give you like a paracetamol or an acetaminophen to bring down the fever. That's all that we can do because we are treating only the symptoms. When a person starts exhibiting symptoms of COVID, we should isolate them. So there are two words that sometimes get confused. One is isolation and one is quarantine. I'm sure you have heard both these terms before, but I'm going to explain to you what is the difference between them. Isolation means when we take a person who is infected with the disease, we know that this person has COVID, and when we put them separately in a room and prevent them from going out and infecting other people, that's called isolation. Quarantine means we are putting people separately and keeping them from transmitting it to others, but these people are not infected. People who we put in quarantine are healthy people who may have come in contact with an infected person. Like when we take a flight to another country and then come back, then our government will put you in quarantine because this is just a precaution so that if you have the disease, if you got it from somewhere, you do not spread it to other people. That is the difference between isolation and quarantine. In most parts of the world, the quarantine period for COVID people is 2 weeks. This is because the incubation period of the COVID virus is considered to be anywhere from 2 days to 2 weeks. So what is incubation period? Incubation period is the time from when a person is first infected with the disease to when the first symptoms start to appear. For coronavirus patients, they could start showing symptoms 2 days after infection, or it could be 10 days, or it could be after 2 weeks. So like we talked about earlier, there are a lot of asymptomatic people. Even if they're infected, we don't know that they're infected. That is why it's very important to track the people who an infected person came in contact with. This is called contact tracing. Contact tracing is usually done by the government officials. Generally, the public health officials will contact an infected person and they will ask them questions. Where did you go? Who did you meet in the days leading up to the infection? And all of these people will get contacted. Whoever came in contact with an infected person will get contacted by the government officials and they will be asked to quarantine. The purpose of this is to not spread the disease, to contain the spread of the disease. That is the purpose of contact tracing. In some cases, contact tracing is also done by researchers who are trying to figure out how the disease spread in a community. This happens after the spread of the disease is over, and the purpose of it at that point would not be to contain the disease, but to just study how it was spread. When the coronavirus first comes into a community, it is usually from an external source, right? Somebody travels to another community where there's a lot of COVID people, and then they bring back COVID to their own community. That is how it first comes into communities. But when coronavirus starts spreading from person to person within the same community, then we call that there is community spread. When there is community spread, people will not be able to identify, this person got it from that infected person. People don't know where they got it from. It just spreads around from person to person within the same community. That's when we call that there is community spread happening. When a person who has COVID spreads it to not just 1 or 2 people or 10 people, they just spread it to a lot of people, then we call them superspreaders. There are events that have been reported called superspreader events. Those are large gatherings, like it's a wedding or like a school function, a church function, any of those kind of large gatherings, and 1 or 2 COVID people who are infected would go there, and a lot of people would get sick from just one event. Those kinds of events are called superspreader events. Another reason why COVID is hard to contain is because testing is not at all reliable. When a person takes a COVID test and the result is negative, they are happy. They go home, they relax, they meet their friends, and because they think that they are not infected. But this could be a false negative. A false negative means a person is actually COVID positive, but the result showed that they are negative. The same thing vice versa for false positive. There are false positives and false negatives happen all the time in COVID tests. All the governments in the world want one thing when it comes to COVID. They want to flatten the curve. What does that mean? Flatten the curve. So when people in a community start getting infected with COVID, at first there are a few people, then more and more people are getting infected. So when the number of people who are infected becomes larger than the number of available beds and the capacity of the hospitals in the community, then people will not be able to get treatment. We can achieve flattening of the curve by following social distancing, wearing masks. All of these are means of flattening the curve, which means keeping the number of cases to a small level, a low number of cases over a longer period of time. That is what flattening the curve means. I hope this video has helped you understand some of the COVID terms. If you found it useful, please like and share it and subscribe to my channel. Thank you for watching.